I am Dr. N.S Bisht, Senior Physician, ICU in charge, District Hospital, and with me, JR from Himalayan Institute of Medical Sciences, Dr. Naina Mehta. Naina, have you seen it often that doctors and medical staff don't do the CPR properly, and
Very
what's
often.
the logic?
Very often, sir. Sir, I feel the knowledge is limited. People are not aware. Even the staff is not aware how to do proper CPR.
Yes, in the hospital setting also, we have seen shock not given, timely shock not given, and also that the CPR quality is really very poor because we don't have a resuscitation program. We don't yearly basically train our students or medical staff regarding the CPR, and obviously it results in a very poor CPR outcome that is with us. So, uh, as in advanced countries like American Heart Association is the pioneer in resuscitation science, they are trying to save as many lives as possible,
Yes.
but still there is no focus on CPR in our country. So I am trying to highlight for the doctors, for the physicians itself, that why we do CPR, uh, why we do CPR, and how we do CPR. First of all, CPR means chest compression. First of all, CPR means chest compression in a patient who is clinically dead. Clinically dead means the patient has no pulse, no breathing. So, patient is unresponsive. So, CPR is done in a patient with cardiac arrest. We will define death afterwards, but cardiac arrest is equivalent with clinical death, but if CPR fails, only then we will say the patient has died. Now, CPR is needed for two primary reasons. We know when the breathing has ceased and the heart does not beat, the patient still has 4 minutes oxygen reserve in the body. 4 minutes oxygen reserve. So even if you don't give ventilation, you give only chest compressions, you can resuscitate the patient. This is why. This is the heart in the center of the chest, behind the sternum. So what is happening is this heart is not contracting. See, heart contracts, systole, diastole, systole, diastole, systole. Heart contracts like this, and when the heart contracts, it generates a pulse. The pulse is what perfuses the tissues, the vital organs. So without the pulse, the organs and tissues are not perfused, they are going to die. So brain has a limit of maximum of 7 minutes. Without CPR in a case of cardiac arrest, the brain will sustain irreversible injury. So this heart is not pumping. Not pumping means it has no systole, it has no diastole. If it has no systole, I can give systole from outside. Got it? I can give systole from outside. When I am doing this chest compression, actually I am pressing on the heart from the outside, and this external force is generating systole. Okay, the function of systole is to supply brain. In this case of CPR, the brain, at least about 1/3 of normal blood supply reaches the brain. The function of systole is this. Okay, I compress this and I leave. This my hand recoils, chest wall should recoil back. Okay, when it recoils, negative pressure is generated in the chest, and what happens? The heart will refill. This is diastole. So if I do systole and I release my hands, diastole will be automatically generated and during the diastole the heart will fill, also the coronary artery will fill. So the function of CPR is very concise and very scientific, that when you are doing chest compression, actually what you are doing is that you are creating or generating or building an artificial systole from the outside. Systole means contraction. Your compression of the chest is generating a contractile response in the heart. By compressing, it is becoming a systole, and through the aorta, the uh, blood is supplied to the great vessels and the blood reaches the brain. This is the function of CPR. That's why you do CPR. And when I compress, then during the recoil, when the heart is filling again, the coronary artery is also filling and heart is also getting its share of blood. If heart does not get its blood, the arrhythmia that has occurred or the asystole that has occurred, there are 4 types of arrhythmias that's called cardiac arrest. Whatever has happened to the heart, we cannot bring it back unless we give food and oxygen to the heart muscle cells. Unless we give food to the cardiac cells, oxygen to the cardiac cells, that is substrate and oxygen to the heart, we cannot regain any of the rhythm even after the shock. So the function of cardiac compression, chest compression, which is equivalent to cardiac compression, is equivalent to CPR. The basic thing is CPR should be considered as chest compression that should be uninterrupted, no time wasted in ventilation in most of these scenarios, particularly outside the hospital. Inside the hospital, if you have other team members, other care providers, you can actually try to do other things like umbo mask ventilation and even intubate the patient, but without this interruption in chest compression. Chest compression at the rate of 100 to 120 per minute should be continued. I told you there is at least 4 minutes reserve of oxygen. So this way it is done. You don't lean like this, okay? Elbows has to be straight. Hands are palms, these can be interlocked or you just put them, but this is better. This way, straighten your elbow and your hip joint moves, not your shoulder joints, like this. All force comes from the hip joint, this. And the depth has to be at least 5 centimeter, 2 inches, 2 inches. So my basic advice to all physicians is don't ignore and don't interrupt the chest compression, because you are basically compressing the heart. You should know, you are not compressing the lung. You are, the tidal volume generated by the chest compression is very low. It does not help. You are not making the patient breathe. You are making the patient perfuse. And your CPR is not converting a rhythm into something else. For example, if you are doing CPR, the patient has an irregular heartbeat that is not generating a pulse, like pulseless VT or ventricular fibrillation, whatever we call it. It will not be normalized without shock. Always remember, shock has to be given. That is through AED. But before that, we need to perfuse the heart. The coronary perfusion should be maintained. If you have not perfused the heart, how will the rhythm return to normal even after the shock? That's the issue. That's the basic issue with CPR is you have to at all cost do uninterrupted chest compressions, and particularly in the hospital setting where so much help is available, the main focus should be on chest compressions so that you can create an artificial what? An artificial systole. You are, when you are compressing the chest wall, you are compressing upon the heart ultimately, and ultimately a systole. The heart is compressed like this and it pumps blood in towards the brain, and it refills again, and coronary artery also gets blood. So you have to do both things. A simple act of compression and release will give blood to both the brain